treatment, I will ensure that I do my hand hygiene using a hand gel, following WHO steps for hand hygiene. Palm to palm, back of the hands, fingers interlace, fingers interlock, rotational cleaning of thumb, fingertips, and let it air dry for 30 seconds. So, hello Jane, my name is Paula. How are you?
I'm good.
So Jane, I am here today as I will be inserting a fine-bore nasogastric tube into one of your nostril. So it is ordered by the doctor as you were having difficulty when swallowing. This is to ensure that you are not at risk for any aspiration. Am I getting your consent for this?
Yes.
Thank you so much. So I need to assemble my equipment, but first I also need to do my hand hygiene again using a alcohol hand rub. So I have to make sure I have my disposable tray, which is visibly clean, dry and intact. I'm happy to use that. I have here my basin to give to my patient later on, dry and intact. I have here my collie pot with water to lubricate my nasogastric tube. I have here 60 ml enteral syringe, dry and intact packaging, expires 2028, 531. I have here my pH indicator strip, dry and intact packaging, not exposed to air or sunlight, expires 11/20/28. I have here my couple of tissues just to give to my patient later on. And then I have here my nasogastric tube, expires 11/20/28, dry and intact packaging. And I have here my tape to secure the tube later on to my patient's nose and cheek. So right, I have assembled all the equipments I need for this procedure, and I'm happy to go back to Jane. So hi Jane, are you still comfortable?
Yes.
Okay, so I will just ensure that I am wearing my PPE before we start the procedure. Okay?
Okay.
So I have everything with me for this needed for the procedure. So I will need first to explain to you that throughout the procedure, if you feel like you are feeling discomfort, you could raise your left hand for me so I know if I need to stop with the procedure. Are you able to do that?
Yes.
And also, I have to make sure that you're sat in a semi-upright position, so I'm just able to assist you there, and I'll make sure I put the pillow just right behind your back or your head, just to make sure that your head does not move forwards and backwards as I insert the tube. So are you comfortable?
Mm-hmm.
Okay, so after that, I need to just measure the tube. So this is called the NEX measurement, wherein I have to measure. So I have to measure the tube from the tip of your nose to your earlobe, and then from your earlobe or tip of your ears down to your sternum. Okay, so that's 55 centimeters in total. So I will add 5 centimeters just to additional, so that will be in total of 60 centimeters. Okay, so next I'll be doing before I lubricate the tube, I need to check for the patency of your nostril. So first, I need for you to cover your left nostril with your nose and try to sniff for me.
Sniff.
Okay, and can you do that to the other one? So can you cover your right nostril and try to sniff?
Sniff.
So I can confirm that both nostrils are patent. So which side would you prefer?
Right nostril, please.
Your right nostril. So, okay, so we'll insert the tube to your right nostril, okay? So, before that, I have to lubricate the nasogastric tube. So, just make sure to lubricate the tube about 15 to 20 centimeters. So, I have lubricated this with the warm water. So, before I insert the tube, Jane, I'll just give you this receiver, just if in case you feel a bit sick later on, so you have that for you. And I'll also make sure that there's an working oxygen and suction in the room, okay? So are you ready?
Yes.
So Jane, I'll be inserting this tube as you inhale, okay? So take a deep breath, inhale.
Inhale.
So inserting the proximal end of the tube to your right nostril in an inward and backward manner, making sure it passes down to the floor of the nose to your nasopharynx. There's no obstruction, so otherwise I will use the other nostril or insert it in a different angle. Are you able to open your mouth for us, Jane?
Yes.
Okay, I could see that there's no coiling of the tube, so you able to swallow now?
Swallow.
So right?
Swallow.
Okay, so now it passes down to the nasopharynx, down to your esophagus. So I'm just continue inserting this. Since I don't see any distress or signs of difficulty in breathing, I'm happy to advance the tube further down until it reaches your stomach. So swallow.
Swallow.
Okay. So right, I could see that the measured indicator, which is a 60 centimeter, is just outside of your right nostril. So I'm happy to secure the tube through your nose. So I'm just going to secure it. And I'm going to secure it through your cheek as well, Jane. How are you feeling?
Not too bad.
That's good. So Jane, since the tube is secured to your nose and cheek, what I'll be doing next is to get the 50, 60 ml enteral syringe. And now what I'll be doing is I'll be aspirating stomach contents from the tube to confirm the placement or position of the tube. And I'll be using the pH strip to check it, okay? So I've just got about 5 ml of gastric contents, and I'll be closing it using the integral cap. So I'll just be using this receiver for a bit, and I'll be getting the gastric pH. And I will leave some gastric contents to that strip and dispose it to the waste bin. So I'll be waiting for about 40 seconds for the result. 40 seconds passed. So the gastric pH result is 4. So the gastric pH level result is 4. So Jane, the gastric pH result is 4. So the tube placement is confirmed. So it's within the normal range because the gastric pH level should be 5.5 or less. Okay?
Okay.
You got your call bell there. If you got any need or assistance needed, please feel free to press that. I'll be happy to help you. Meanwhile, I'll be disposing of my equipment to the clinical waste bin apart from the strip. Now I'll be removing my PPE. So Jane, are you still comfortable?
Yes, thank you.
Thank you. So again, just to remind you, additional checks or pH checks will be done just to ensure that the placement is in the tube is in place. before giving you any medications or food through your tube, okay? And in some circumstances, radiological test will be performed, okay?
Okay.
Again, thank you for your time, and I'm just gonna leave the room now by doing hand hygiene as well.